Hi, good morning everyone. My name is Venny Vidayanti. I'm from Indonesia. Currently, I'm a lecturer and researcher at the Maternal and Child Health Department at Respati University, Yogyakarta, Indonesia. I'm also as an active volunteer for women's health in Yogyakarta, Indonesia, especially in rural areas. Currently, I'm also undertaking a PhD program in midwifery at the University of Manchester, and my passion is in maternal and neonatal health, and I have previously conducted research in these areas.
Brilliant. Thank you very much, Venny. So, you told us a little bit there about your PhD topic area. And as we know, you're a second year full time PhD student here at the University of Manchester. Would you please be able to tell me a little bit more about that PhD programme? What do you hope to do over the next 3 years in your PhD?
So, as I mentioned before, I'm interested in doing research project in the field of maternal and neonatal health, especially in rural areas. And also, I have a strong desire to improve quality of health services for pregnant women in rural areas of Yogyakarta. So, based on my previous study, I found that antenatal education, it has a significant place to improve maternal and child health. And then I believe that by involving male like in antenatal education will benefit them, not only the women but also like the child for their future health like that. So in my study I propose to conduct a study to explore male involvement in antenatal education, especially in rural areas of Yogyakarta. I will conduct a qualitative study for my proposed project, and my study will focus on rural areas since there was a high maternal mortality rates and with varied and unstandardized antenatal class programs.
Brilliant. Thank you very much. So, just to summarise there, a qualitative study with fathers to try and understand a bit more about their involvement in antenatal education programmes. Can I just ask, before that qualitative study, are you doing any searching of the literature?
Yes, of course. So in my second year, I'm doing an integrative review at the moment since I found that the integrative review will be useful for my study. So I could find the gap of knowledge based on the previous findings about how male to be involved in antenatal education as well as antenatal care.
Brilliant. Thank you very much, Venny. I just wanted to ask you, how did you become interested in this as a topic area?
Personally, I'm interested to conduct a research to explore about maternal health, neonatal health, and the factors that contribute to the high maternal mortality rate in Indonesia. So based on the previous findings from my study indicated that we have to involve people, especially male partners, for the pregnancy since most of them they didn't have enough knowledge how to manage the complication within pregnancy, and then we have to educate them like that. So I believe that within exploring about male involvement, and we could identify what should we do in the future to make a robust and standardized antenatal education program in rural areas of Indonesia especially.
Brilliant. Thank you very much. So, if anyone's listening to this and maybe they live in rural Indonesia, maybe they're a pregnant woman or they are a male partner or a healthcare provider, or they're just generally interested, how can they become involved maybe in your work?
Okay, so I believe that within this study, I couldn't do it by myself. So I will involve the community itself, and I also bring the local government to support my study as well. And within my study, I propose that I will involve village midwives working at the primary healthcare centers in rural areas so they could serve as a gatekeepers for my participants like that. And then also I will engage with the community healthcare workers as well so that I could get so much information about how I get my participants for my study.
Okay, so if any of those people are listening now, how could they get in touch with you maybe to talk to you about, once you have your ethical approval, how they could work with you to try and identify those people?
Okay, so I'm more than happy. Like, if anyone would like to talk with me about my research project, and if anyone like interested to help me to conduct my project like that, so you could contact me by email or via social media. I will be very, very happy for that.
Would you like to tell them your email
Okay,
address?
so my email address is it's Venny Venny dot Vidayanti Vidayanti at postgrad.manchester.ac.uk.
And if anyone didn't write that down, you will be able to Google Venny at the University of Manchester and find her page and her email address there as well. Brilliant. Thank you very much, Venny. Okay, so if you don't mind, next question, Venny. Could you please tell me what you hope to gain through this PhD? What do you hope to have gained by the end of 3 years' time?
Actually, I would like to continue my PhD to expand my knowledge, skills, and insight in conducting quality research, as I believe that now I'm a novice researcher and I want to build a network, collaborate with international researchers so that in the future my research and its finding could be more impactful. So concerning my future career plans, my ultimate goal is to be a specialist in the field of maternal and neonatal health. So the first thing that I want to do after graduation and after I finish my PhD, I'm planning like to provide an informal education and a standardized prenatal class model in a rural areas, not only for the pregnant women but also within the male involvement. I also would like to collaborate with non-governmental organization as well as the local government, and I will work with them from a multidiscipline background so that I could make like a more a more standardized program for antenatal education.
Brilliant. Thank you very much. Lots of exciting things to come. And obviously, we can record more podcasts as and when your pieces of work come out as well, your systematic review and your qualitative study. So, just a final question, Venny. If people are listening to this now, maybe in Indonesia or here in the UK or anywhere actually, and they're thinking, oh, I like this work, I like what Venny's saying she's doing, I like this career plan. What tips would you give to them about coming into a research career, particularly a PhD?
Yeah, so for me myself, Debbie, I'm from Indonesia, so I didn't speak English, right? So this is like really a good experience for me to develop my skills. And then when I'm trying to apply for the PhD, I believe that I have to learn English, and then I have to learn about academic writing, and then I have to learn about research design. So if anybody like from Asian, from Indonesian would like to continue their study in the UK, especially for the PhD program, then I could give them like some tips that they have to be believe in themselves how to achieve a PhD like that, because this is a challenging as well a good opportunity for us to develop our skills and to be an expert in as a researcher like that.
Thank you very much, Venny, and good luck with the rest of your studies.